My name is Mackenzie Guy-Cormier. My pronouns are she, her, and I'm a Métis Student Office Assistant with Community Engaged Learning at the U of M. I will be facilitating the mental health and patient advocacy panel this evening. So I would like to start off this part of the evening with a land acknowledgement. I'm joining you tonight from my home, located on the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. These are the lands of my ancestors. I am privileged and so grateful to live, work, and learn on Treaty 1 territory and to have access to natural resources from treaties across the country, such as water from Treaty 3 and hydroelectricity from Treaty 5. As a Métis person, I have a responsibility to my ancestors and to my community. With every action, I must strive to honor these lands and the people who cared for them before they were taken away. As such, I commit to challenging the injustices that Indigenous people face and to supporting the work and leadership of Indigenous communities. So as Luca mentioned, we have three wonderful panelists with us tonight. So I just want to let the panelists know a little bit about the facilitation plan. So I'm going to start by reading off a question, and after the question is read out loud, I will ask one panelist at a time to unmute their mic and share their response. If you don't have a response, that's also a valid option. If at any point you want to add to what another panelist has said, please feel free to use the raise hand function. It can be found in the reactions menu at the bottom of your screen. So I will then call on you to unmute your mic and you can share your thoughts. Are there any questions from the panelists before we get started? Uzoma?
I do not have a raised hand reaction that I can figure out how to use, but I do have a thumbs up. So I just wanted to let you know that my thumbs up will be the raised hand if that's okay.
That's perfect.
Okay, thank you.
Okay, so without further delay, I would like to invite Uzoma to unmute their mic and start us off with our first question, which is, can you introduce yourself and explain a bit about the work that you do in mental health and patient advocacy?
Sure, absolutely. Thank you so much. It's really nice to be here. I really appreciate receiving the invitation to participate this evening. It's great to see so many familiar names and faces here as well. And, you know, I want to acknowledge that I know many folks are navigating some very challenging times and personal experiences. And so very grateful that the organizers, you know, put in the effort to hold space this way and talk about really important issues. And I also want to send my care out to folks. You know, like I said, many folks are navigating just ongoing challenging times and experiences. So a little bit about who I am and my background. I am currently the MLA for Union Station and the critic NDP MLA for Union Station and critic for health, seniors and seniors care. That just means that I represent a constituency of about 22,000 people in the downtown, some of the West End, West Broadway area of Winnipeg. And my responsibility as critic for health is to advance and advocate health equity in Manitoba. So making sure that not only do the constituents of Union Station, the residents of Union Station in the core of Winnipeg, are having their voices heard at the provincial level of government, but also that issues around health that affect Manitobans very broadly are being advocated for in a way that closes those healthcare gaps and moves us in a direction of health equity. My background before being a politician, which happened in 2019, so it's not like I'm some seasoned politician. I'm not well seasoned. I've maybe just got like a little salt and pepper, no paprika or anything yet. It's a very bad joke that I just made up just now. But my background is that I'm actually a registered psychiatric nurse and addiction specialist. I worked as a psychiatric nurse for well over a decade, primarily in youth mental health and substance use addictions, same with adults as well. My passion is community service, community organizer, activist, trying to provide supports and safer spaces and resources for Indigenous, Black, and people of color who identify anywhere on the Two-Spirit and LGBTQ IA asterisk at the end there, plus at the end there, spectrum. So that's kind of a bit about my background. I'm very grateful to be able to be in the role that I am now as a public servant. I take it very seriously, and I'm happy to be here to help contribute to this conversation. So thank you.
Thank you, Zoma. And that was a much better joke than you thought it was. So I'd like to call on Sanda now to unmute her mic and introduce herself and explain a bit about the work that she does.
Good evening, everybody. As Mackenzie introduced, I'm Sanda, or my real name is Sandakala, and I represent Tribe Community Circles, that's in West End. And it's kind of a coincidence that Zama and I both represent, not really represent West End. We work around the same area, but we have never met each other. And that shows, now we are about to talk about the resources, community resources. That made me ask, do we really know our resources? Right? So that means we still need to grow and explore. About myself, I'm a counseling therapist, and I've been with Thrive for the last 3 years. Before that, I moved here from Dubai. So I have some kind of international experience, which I have worked about in about 6 different countries. And coming here and starting to work was a challenge, but I think I'm comfortable doing it. And especially that exposure made it very easy for me to interact with a multicultural community. West End we get all kind of population, First Nations, African, Asian, white. So it's a mix of everyone. So my experience became very handy. And Tribe Community Circles, they do a lot in terms of advocacy and support and helping people to deal with poverty. We have a resource center, and we do have an emergency food bank. We do offer coffee and lunches. And I would, Thrive is an organization that applies trauma-informed care. So we kind of have a reasonable awareness about trauma and poverty. So with that approach, I would say most of our staff members are very successful making a connection with the population. I believe that what makes us special. I believe Thrive is special, and the difference is being trauma-informed, the approach they show to the community. And we do have a thrift store, which offers very competitive prices. And we have, I would say we have one of the best childcare facilities as well. Till last year, we just had a small division for therapy and counseling with 1 therapist. But during the pandemic, it grew fast. And now we have 3 therapists, 2 full-time therapists and part-time therapists. Most of the time our part-time therapists are master students. And personally, I offer solution-focused brief therapy, EMDR, narrative therapy, and CBT. But most important—
Can I ask that you say what those mean?
Yes, sure. Solution focused brief therapy, name itself gives the meaning, right? Even narrative therapy sometimes is being misunderstood for just talk therapy. It's not just talk. We encourage the clients to narrate their story and encourage them to look at the parts that are not identified in the story, the hidden parts, to make it complete. So that's the background of narrative therapy. CBT, probably most of you know, it's cognitive behavior therapy. Yeah. And I forgot mindfulness. That's one of the, that's a big time therapy we practice, mindfulness at meditation. We do that. And EMDR, that's eye movement desensitization and reprocessing. That's a very weird name, but that's exactly what it does. With bilateral movements, we try to connect both sides of the brain and process information. So that's about me and Thrive. Any questions?
Thank you, Sanda. That was really informative.
Thank you.
Interesting to hear that the counseling grew over the pandemic. I'm really glad to hear that that was something that Thrive was able to do. I think it's very important.
It was a need.
Yeah,
We got so many calls, so we had no choice to have more counselors. And luckily the funders we got some funding. So thanks to that, to the donors, now we have a department.
That's awesome.
Thanks.
Michael, would you care to unmute your mic and introduce yourself and some of the work that you do?
What's up, everyone? My name is Michael Redhead Champagne. I'm honored to be on a panel and hanging out with such awesome people today. So shout out to my panelists. And shout out to you, Mackenzie, you're being the hostess with the mostest. So thank you all very much to everyone who's here today. And my name is Michael. I am a community organizer, public speaker from Winnipeg's North End. I've been like a mental health advocate for a number of years and been active. I'm really passionate about like access to service. Like I'm hyper passionate about that. So I actually worked with Kids Help Phone for a number of years on their mobile texting advisory service, so that now everyone hopefully knows that there is a 24-hour-a-day, 7-day-a-week mechanism in Canada for people to access mental health supports 24/7 through Kids Help Phone. And now there recently is one for adults too. So like that's an example of one of the projects that I was involved in and around mental health, as well as other kind of larger campaigns that just try to encourage overall wellness. So I come at things primarily from an Indigenous lens. I'm First Nations, originally from Shamattawa First Nation in Manitoba. I'm a product of the child welfare system, proud North Ender. So I see we got some downtowners, and y'all are all right. We love downtown and the North End. But the North End is pretty great, gotta say, awesome community. And I'm really happy to be from here. We have a really strong urban Indigenous community here that organizes very, very beautifully in response to a lot of the challenges that we're facing. Currently, tons of folks are responding to the need for supporting evacuees that are here being displaced because of the fires. The adult one is 471-471. Yes, the texting for adults is free for adults, 471-471. You can text that one 24/7 as well. And so in Winnipeg, and I think probably why I was asked to be here today is because I'm also involved with an amazing group of helpers, primarily led by women, called Health Buddies Winnipeg. And so Health Buddies Winnipeg is a coalition of human beings that are passionate about providing support to community members here in Winnipeg as they go through the medical system or emergency rooms or whatever medical environment it may be. We've been in percolation mode for about 1.5 years now and have yet to actually deliver any services, which is very, very hard for us. But we are working as volunteers to develop a structure that is a really, really good structure. And it's taken longer than we wish for it to, but we feel like it's important for us to be very diligent in the way that we put our work together and line up our structure. So yeah, Health Buddies Winnipeg, I'll tell you guys a little bit more about it later. Some of the Health Buddies I think are actually on this call today, which is fantastic. Yeah, I'd love to share more information about where we hope to go with Health Buddies Winnipeg and how more people can get involved, as well as if there's time to share some of our ideas on what we could do today to make healthcare rapidly improve in Manitoba.
Thank you, Michael. Yeah, I can't wait to hear more about that. We're going to move on to our second question already. So I'd like to invite Sanda to unmute her mic and share with us, how can someone go about finding mental health resources?
Well, I think Michael is very knowledgeable, and probably he and Zama would be able to give better information. But coming from, I think my approach was, because I was not from Winnipeg, I had to learn. So how I learned, I think it's important to share, because now I think I'm much more knowledgeable. Within a couple of years, I learned a lot. So right now, I would say the best place to begin is Help Starts Here 211.ca. That gives so much resources and steps that one would want, can proceed. That's a good way to begin. And obviously the simple common sense things, other things, like if you have a resource center close by in your neighborhood, take a walk, ask them, what are the resources? Be open. And if you're a student, ask your student counselor or ask your doctor, approach Access Clinic. Seek help actively. The moment you decide that you are going to seek help, the whole world is open to you. There are a lot of options. We don't see them, but you come across when you ask that question.
I think that's a wonderful way of putting it. The second that you start to seek help, the whole world's open to you. I love that. So next, I'd like to call on Michael. How can someone go about finding mental health resources?
I really love what you just finished with there as well. I just wanted to emphasize that that was a really beautiful point, because it fits with what I was about to say. When we are trying to look for help, I always break it into 3 chunks, just because it helps me understand where I got to go. So the first one is recognizing that I need help. Okay, that's already hard enough for people, right? Hard enough to be like, I need help. So step 1 is recognizing that they need help. Step 2 is reaching out for the help. All right, and it's difficult reaching out for help in this current environment right now, especially around mental health, or anything really health related because of the pandemic. So that's difficult, but it's important to do. That's the second thing to do, to reach out for help. And then the third thing to do is to accept the help. We often don't get immediate results in our healthcare system. We often have to have multiple follow-up appointments. We often get referred to some other place or some other person, or we have to wait because everyone's on vacation except for us. And, you know, like, so, you know, when that happens and you don't end up receiving the help, you know, proceed to step 2, where you ask for help again, you know, and like, you just got to keep asking until you end up getting it. And the squeaky wheel gets the grease, unfortunately. And I know a lot of people, especially from Indigenous communities, especially people from the North. I can say this as like a general, I don't want to generalize all Northern folks, but a lot of folks that I know that come in from the city, from the North, are very shy. And I'm like a weirdo amongst Indigenous people, because I will yell around, I will flip tables. You will know when something's happening in and around Michael's world. But what we need are advocates to be there to help make sure that every single one of our relatives that needs help gets it, because I know a lot of people struggle with asking for help. And so I think about those 3 steps. And if we're going to struggle anywhere along the way for those 3 steps, that's where health advocates come in. And I feel like our mental health often affects our ability to take care of our regular health. And so like, I don't want to ask for help. True story. I recently tried applying for health insurance. Okay. Health insurance, right? People need this for like, you know, additional mental health and additional dental. And you know what they said? Oh, Michael, you have a chronic condition. And so because of the chronic condition you have, we'll approve you for a plan, but we're exempting pain medication, anti-anxiety, anything related to possible management of your chronic illness. And I'm like, are you literally approving me for all of the health care that I don't need? Is that what I'm hearing here today? And they're like, yeah, well, you shouldn't have told us about your healthcare challenges because now those are exemptions. And if you want them covered, you have to pay more. And so anyway, I didn't mean to turn that into a rant about private insurance, but needs to be part of the conversation too. Because how are people going to get mental health care? How are people going to get dental care? A lot of folks that aren't treaty don't have access to those things. And even for First Nations that are treaty and some of their costs do get partially covered, it is only partial. And so there are a lot of costs around mental health and dental specifically. I'm going to pick on those ones that people really need help with. And then the other challenge right now is that people don't know what their healthcare rights are because it's hard to find proof or anywhere in Manitoba, anywhere that says I have any legislated rights. The only legislated rights I see in Manitoba is I have a right for my personal healthcare information to get it myself or to let someone else see it. And so that's from the Personal Health Care Information Act. And there's no legislation at the provincial level to legislate my rights, to legislate good treatment, to legislate anti-racist treatment, to legislate trauma-informed care or harm reduction approaches. And so maybe there's opposition health critics somewhere who might take this idea and make it law. Anyway, I'll stop there.
Thank you, Michael. I really like your third step of accepting the help. I feel like a lot of folks skip that step, and I saw a lot of nods from people in the room right now. So thank you for that. Usama, do you have anything to add to that question?
Yeah, sure. Thank you, Michael, for your last comment. Noted. And I want to thank Sanda for their remarks as well. I don't have a ton more to add. I think that they did a great job of covering some of the key areas and providing recommendations. A couple of things that I will talk about though are, one, I really want to sort of amplify what they've said about accessing help, right? Like once you recognize that you need some support and you need some help, you also have to recognize that you deserve the help that meets your needs. And, you're worthy of receiving the care that meets your needs. And it's really important for us to recognize that, and there's a lot of data, a lot of information, research to support the fact that even if people, let's say within the Black community, African community, I'll speak to what I know as a Black African person, even if we have access to the same types of primary care, right? Even if I have a primary care doctor, the same way that a non-Black person, a white person to be specific, does, it doesn't mean that I'm going to have the same sort of positive healthcare outcomes as that person. And that is because primary care does not necessarily mean I'm receiving culturally appropriate care. It does not necessarily mean that I'm receiving the care that I need within my identities to have good healthcare outcomes. And so it's really important for folks to also know that you deserve to receive care that recognizes all of your identities as a whole person, as a unique person with unique experiences in a world that is unique to you. And that sometimes that requires a bit more of a push. Sometimes that requires for you to reach out beyond just yourself to make sure that you're getting your questions answered and that you're able to access the services that you need, but it's worth that effort. And there are people who recognize the importance of that who will help you. And so with that in mind, I would also suggest that people contact, and I like that Sanda identified this, like reach out to local resources that you know about, right? It could be, reaching out to the social worker at your local public library. I know Millennium has some plans in place for that when they're able. Reaching out to your local MLA's office. We have a responsibility as MLAs to know what's going on in our communities, what resources exist, so that when people call us, maybe I can't be the therapist on your phone that day, right? But maybe I can be the person who directs you to the resource where you can get access to that therapy or whatever it is. So, don't shy away from, and I know it's uncomfortable. Like I know it's hard. I know it's uncomfortable to reach out and make that call or go down and knock on that door or whatever it is. But you deserve to get the answers to the questions that you have in terms of how you can be healthy. And so those are probably the last couple points that I would make. And actually the very last point that I would make is, be kind to yourself in that process and do your very best, outside of like an emergent acute situation, to try and be patient with the process as well. I think about what it means to get any answers to healthcare questions, right? If I'm sick and symptomatic, I don't, like, for personal example, diagnosed with asthma only a handful of years ago, and that came out of other healthcare issues. It took a long time to get to that diagnosis, which for me was like super frustrating. But I had to be patient in order to finally get the answer that I needed in order to figure out what was going on and how to best take care of myself and receive care. And sometimes it takes a couple different doctors or referrals or whatever it is, but sometimes there's a bit of patience in that process if we have the capacity, if it's not an emergent, immediate, acute situation that we have to go through. So those are the few things that I would add.
Thank you, Uzoma. Yeah, I really liked your point about deserving the care that meets your needs. I think that that's really important for people to hear. So we're going to move on to our third question for the evening. What short and long-term mental health care options exist for low-income community members? Sanda, would you like to unmute your mic and share a response?
Yeah, sure. And before I answer to this question, I would like to add something to Zama's comment, which is great. You deserve care. You need to be and especially being culturally specific. That's very important with mental health. Mental health support, especially counseling and therapy, needs to be culturally appropriate. If not, we are in a way confusing the client. The world is what you perceive. That's the reality. So, Osama, thank you very much for bringing that up. Getting back to the question, well, in terms of mental health, if you are in crisis, I can think of 3 crisis help: Crisis Response Center in Bannatyne Avenue, and Crisis Stabilization Unit. That would actually allow you a short stay. And clinic, probably most of you know clinic. And even Victoria Hospital has a psych unit, which is said to be very good. In receiving free short-term therapy, Access centers do have 8 to 12 weeks therapy sessions. Sarah Real Foundation, some community centers like us, Woosley Community, and Spence Neighborhood. So that means I don't know most, but some community centers do have short-term therapy, and women's hospitals and children's hospital, they do have. But most of them are limited 8 to 12 week sessions. If someone needs long-term therapy, one of the best resources are Canadian Mental Health Association. They have so many resources and long-term therapy. And obviously as Thrive, there is no limit for sessions. So we do both long-term and short-term therapy, but we are not a crisis center. New Directions, Aurora Family Therapy, Family Dynamics, McDonald's Youth Services, and Aboriginals Women's Center are some of the places that you can really access free long-term therapy.
That's perfect. Thank
Any-
you, Sanda. I hadn't heard of quite a few of those actually, so it's nice to have someone bring up those resources. And I think for folks who are like me and are very slow writers, Annie has been kindly putting all of these in the chat for us. So if you miss something, don't panic, it's there. Yeah, thank you. So next I'd like to invite Michael to unmute his mic and share a response.
I just want to acknowledge the robust conversation that's happening in the chat right now around the relationship between policing and mental health and overall health, and how often wellness checks are problematic from a mental health perspective in Winnipeg. And actually Sean, who's leaving some comments in the chat, shared some information with me as well. The Winnipeg Police released their report last week, talking about how many service calls for service they've gone on. And the number one most popular thing that they went to deal with was wellness checks. And so I just feel like that's not appropriate. I feel like we literally anybody else, not literally anybody else, I shouldn't be so dramatic about that, but like we need people that have the training that we've been talking about, that trauma-informed care, people that aren't necessarily showing up and gonna be like, have the, like take people away and confine them. And so that's gonna make people less likely to ask for help. Because so many of our health resources are intertwined with policing. And so I struggle right now with the overall safety of the healthcare system, because even if you leave from somewhere, if I call Bannatyne and I go there and I leave before they say I'm ready to leave, they will dispatch the police to come to my house for a wellness check. And so thank you for listing all of those things, but I just think it's important to name the problematic things that exist within our system that do make it unsafe and make it kind of hard like on our mental health to ask for help related to anything else related to our health. And so I just want to acknowledge that because it's really important to let folks know that it's been really, really difficult. And so I don't know what the answer is. I know that from my perspective, I am working with a number of different groups, like of course Health Buddies, so that hopefully we can have some type of a solution so that community members with this trauma-informed, anti-racist, harm reduction lens would be the ones to go check up on people when they need help. And the other thing I'm working on is with another group I'm a part of called Fearless R2W, and we're developing something called community safety hosts. And this is basically like a very community-minded version of security guards, but that trauma-informed care, understanding colonial history, understanding privilege, understanding, racism and those types of things. And then, being a host, welcoming someone to a space instead of being like, I'm the security guard and I'm the tough guy, because that often doesn't make people feel safe when they're trying to get healthcare. So I don't know if that really even answers the question, but there's an answer of sorts.
Thank you, Michael. You're getting a lot of nods from folks in the room. So I think that it did answer the question. Uzoma, did you have something to add?
Yeah, sure. I want to thank folks. I've kind of scanned the comments as well, and I want to thank Michael for just naming and identifying something that's come up there, and that's very important. And I just want to take a minute to pause and give folks a minute, recognizing that this conversation is not going to land the same for everyone, that we all have our own unique journeys and experiences with mental health and with the systems in which we are told we are supposed to enable to access care. And the reality of it is that, there are some folks who experience violence in the healthcare system, specifically mental health. We can see that happen more frequently than in other places. And so I just want folks to know that, what you're sharing, what you're expressing in terms of your own experiences are valid. and it's not okay, the negative things that have happened to you, and that we have to be able to name and identify those experiences and where they come from and why, in order to actually meaningfully address them. And it can be uncomfortable to do so, but we have to. And so, you know, I'm one who, as much as formal systems I think are important to identify and to share with folks those resources, I think it's equally important to share the resources that maybe aren't listed on the Government of Manitoba website. You know, I think it's important for us to recognize that there are outside of the box resources that exist that are very important, and folks who do a lot of the hand-to-hand provision of care, peer support, helping people navigate situations that, you know, can really be precarious, can be difficult to navigate if you go to a hospital or an emergency room or a crisis center or whatever it is. So, you know, I think about the fact that social media has kind of changed the game when it comes to being able to access a lot of information. There's some great social media pages that are actually maybe not structured the way that we typically might think of mental health resources and support, but are actually really helpful. And I think that there's a lot of value there. So I think about the fact that It Happens Winnipeg is an example of a page where, you know, folks, Black people specifically, were invited to share their experiences with racism within systems, within our city, within our province. But it's also a place where people were able to feel validated in their experiences. It's also a place where different care providers, their information was shared. So there's a whole post around Black and Indigenous and people of color, I believe, who provide mental health services in Manitoba, which, like, where are the places you can go where you can find resources that are specific to the experiences you may have as a targeted and marginalized person in our province, right? So I think social media actually tends to be a place where we don't share some of those resources there enough. You know, I also think about, it's a more recently formed downtown community safety partnership that I had a chat with those folks a couple of weekends ago in the community, and they're an organization that actually does perform wellness checks on folks in community. So if you see somebody in the community who's struggling or you're concerned about, or someone expresses they're struggling, you can call Downtown Community Safety Partnership, and they have resources there to provide some support. um, you know, the police are not the people who should be performing wellness checks. That's not an opinion, that's a fact. They are not trained or equipped or resourced to provide that kind of care, to provide that kind of care. And so it's also, when we think about the folks who can be most harmed in the healthcare system, you know, folks who are targeted and marginalized, folks of color, folks of varying abilities, et cetera, we have to recognize that sometimes first responders, police, are going into those situations with constructs that actually put those folks in harm's way, put vulnerable people in harm's way. And, you know, again, I don't say that as opinion, it's a fact. And it's something for me that's where we have to have these discussions from, if we're going to move in a direction where people can get the help that they need without being terrified for their safety and worried that, you know, because they're in a crisis, the person who's going to show up and provide help may in fact be the person who puts them at greater detriment, in greater harm's way. So I really appreciate that Michael named that and identified that. And I think it's really important that we talk about access to mental health care beyond the formal structures that exist. I think about Sunshine House and the incredible work that those folks do in so many different ways in terms of outreach in the community, and even just having a drop-in space, judgment-free drop-in space where you can go and be in a space with beautiful art around you and good people, and you can get, you know, fed a nice meal and have some hilarious laughs. probably tell and hear some like super inappropriate jokes, like it's those things that I think about that we should be sharing as a resource, and also supporting by way of financial resource to make sure that more and more people can get the support that they need.
Thank you, Zoma. Yeah, it's really nice. We've been doing a few of these panels over the course of the summer, and it's nice to hear when links start to get made between the two. And we did a community organizing panel not too far back, and we were talking about how important it is to be able to rely on the community and the resources that they have rather than just government resources, which actually might cause more harm. Oh, Sanda, you had something to add?
Yes, I know we have a specific time limit, so I'll be very quick. And I must, obviously, as a mental health professional, I think I need to make a comment and add to Michael's comment about this wellness call. Yes, I agree with both of you. Wellness checks can be very hard. And also calling the police or calling 911 when someone says they're suicidal. This can be very, very traumatic. On the other hand, as mental health professionals, we are being obliged, we are being bound to do that. That's part of our service, which I hate to do. I shouldn't jinx, but up to now, for my three years of service in Winnipeg, well, I am yet to make that call. That doesn't mean that we don't deal with people who are suicidal, but that's why I say that we have trauma informed. So we have to be, it takes, sometimes it doubles the time and sometimes it delays the other appointment. We have to talk to them in a way, giving them the power, and finally either they would make the call or they decide to extend the lease of life. So it is, we are changing the approach, but if we can't change that, we are bound to make that call, which none of us really want to do.
Thank you, Sanda, for elaborating. So we're slowly running out of time, which I hate because I would love for these panels to just continue on forever. I'm gonna
Quick comment. I apologize.
Oh, of course.
I put my thumbs up, but it didn't stay up very long. So I just wanted to make a quick comment. Is that okay?
Yeah, go for it.
Okay, thank you. I just wanted to follow up in regards to what Sanda just said and acknowledge that that's very true. And I apologize. I think I probably should have elaborated on that point myself. And I know this as a psych nurse, and as somebody who's worked in those roles, there is a legal obligation that we have to make that call to 911, the police, should someone present in a certain level of distress or express certain things. And I think the point that I'm making, that I know Michael makes, and that other folks in community have made for a very long time, is that the police shouldn't be the resource that is called upon to address those situations. And I know that folks here on this call, Michael and others, have worked incredibly hard to establish resources that are most appropriate to intervene and provide care in those situations. And so I want to make that clear. There's an obligation that many folks have to make that call. And sometimes folks, when folks, regardless of whether or not you're a professional or you're a family member, friend, community member, you do what you need to do to help keep somebody safe and make sure they receive the support that they need. We just need to make sure that we're all working together to get our healthcare system to a place where the most appropriate resources are in place, so that whatever call makes the most sense to make in that moment is available to folks. So I wanted to make sure I clarified that.
Thank you. No, that is very important to clarify. So we're running out of time, and I'm going to quickly combine the last two questions together. So our hybrid question is, what are some good practices for self-advocacy within the healthcare system? And what advocacy resources and supports are available for people who have experienced harm within the healthcare system? So Michael, would you like to start us off?
Sure. So the big thing I always like to point people towards are the things that we can guarantee for ourselves, like, and then argue in a system with, like, you know, like be a lawyer, be a street lawyer, right? So the things that we got guaranteed to us right now is not very much from a healthcare perspective. But there are more things from a human rights perspective in terms of the way we need to be treated with dignity and can't be discriminated against for any of those protected reasons. So, you know, like, I just think that there has to be a way for us to mobilize our human rights and have them respected. I think that's like my big, I don't know if I even have any actual tips for best practices, but what I will say is that Health Buddies is trying to bring people that have lived experience in the healthcare system. We have people on all sides of the healthcare system that are involved with Health Buddies now, and we are really, we have monthly general meetings at the end of every month, and then we have 4 different committees as well. So if you're interested in helping us build communications, one of them is communications, one of them is on structure, research, and legislation. It's my favorite one because it's you know, I like that one. There's our partnerships group, and then there's our training group. So those are the different committees that report to our general meetings, and each of those meet once a month. And we also offer sharing circles because we want to make sure that we can create space just like this so that people can share their feelings in a non-judgmental environment. And so we've also correlated these internationally. Thank you, Andrea, in the chat. We've also correlated some of these internationally to some United Nations documents, such as the United Nations Convention on the Rights of the Child and the United Nations Declaration on the Rights of Indigenous People. So no big deal, but just studying all the legislation and all the jurisdictions, lining it up so that we can get basic, decent service when people go to the doctor. So, you know, just become a lawyer, I guess, is my advice. Or come join us at Health Buddies and we'll like break it down into understandable English like humans.
I have a feeling people might pick that option over becoming a lawyer overnight, but you know, no, it's really great to hear more about Health Buddies and to see exactly how involved and big it's gotten. Uzoma, would you like to unmute your mic and share a response?
Sure. So I think that the question was around health advocacy, right? Self-advocacy. Okay. So one thing that I often encourage folks to think about in terms of being an advocate for yourself is practice that self-advocacy day to day. So, you know, oftentimes we struggle to advocate in some of those situations that are really pressing and urgent and big. Also because we struggle to advocate in the day-to-day situations in our lives and to use our voice to advocate for what we know we need on a day-to-day basis. And it takes practice, right? It takes practice to feel comfortable advocating for yourself. And you know, I'm no different. It's taken me a long time to get to a place where I could advocate for myself as a whole person, to not go to the doctor and feel like I had to leave my queerness out of the room, feel like I had to leave my blackness out of the room, compromise something, some part of myself to feel worthy of the healthcare that I needed. And so I realized that that was due in part because on a daily basis, I struggled at times to advocate for myself as a whole person. And so I started practicing that. I started practicing that in my relationships, in my workplace, when I went to the mall, right? And, you know, in different spaces, recognizing where I needed to speak up for myself. And then in other situations, I felt more comfortable over time, speaking up and advocating for myself. And the other thing that I share with folks is know that you don't have to advocate alone, right? We don't always have the capacity to advocate and fight for ourselves and demand and identify what we need and deserve. And beautifully, in our communities, there are many people who, if you ask, will advocate on your behalf and alongside you. And trust that, know that. Um, all you have to do is ask, and you are, and I keep saying this, but you are so worthy of that advocacy and that care and that relationship. And so, you don't have to ask for it perfectly. It doesn't have to come out the way you think maybe it has to come out. You just have to ask, right? And there are people, there are helpers in our community who will walk alongside you and honestly, like fight like hell for you to get what you need. And so those are two things that definitely come to mind. And the last thing that I would say, and I always say this because it is our responsibility and it's an absolute privilege to be an MLA, reach out to your local representative. That's our job. It's our responsibility to advocate for you. And there's no situation where your representative should say to you, I refuse to help you. There's no situation I can think of, unless it's like something, I don't know, something totally ridiculous. Like that does actually happen. Once in a while, I'll get an email where I'm like, I can't help you. That's nonsensical. Like, what are you talking about? I'm not gonna help you, I don't know, rob the bank or whatever. Nobody, like, that's never been asked. But there are like very rare circumstances where people will ask me to do things that I'm just like, that's this, and I'll communicate that with them and I'll explain why, right? And I'll try and provide whatever support I can that is appropriate and realistic. But that's why we're here. We're here to support you. We're here to listen and help direct you in whatever way you need in order to get the help you deserve. So don't hesitate to reach out to us too.
Thank you very much for that response. Yeah, I think there was a lot of really good points that you made there. I really liked that you said the part about advocating for yourself as a whole person. I think that that's something that people tend to forget to do. So that's great. Sanda, would you like to answer this question as well? Some good practices for self-advocacy and what?
I think Zama covered most of what I wanted to say. So I will give a brief summary in probably 3 or 4 points about advocacy. I think it's a great idea if you are going to for a medical appointment or if you have any issues to sit down to advocate, do self-advocacy, sit down and prepare a list of your concerns and questions. So when you go for the appointment, you are mentally prepared. You have your points and you can demand an answer. And if you are not happy with the feedback you get, don't hesitate to go for the second opinion. You have a right to go for a second opinion. You don't have to blindly take what your doctor or practitioner or whoever says. You don't have to accept it fully. You can go for a second or third. It would take time according to the system. Unless you need urgent care, it's important you become comfortable with the diagnosis and the medication or whatever the care plan. And lastly, if you're not comfortable, if you feel that you can't handle it, as Zama and Michael said, ask for help. Go with someone who can advocate for yourself, who can support. You are worthy. And I never knew that MLAs would do that kind of advocacy. And thank you very much for letting us know. Now we know where to reach.
Thank you, Sanda. So we are steadily running out of time, and I'd like to give the participants a chance to ask you folks some questions. So we're going to move into our Q&A.
It looks like Mackenzie has frozen, so I'm going to jump in here, folks. We do have time for some questions. There were a number of find. But while I'm doing that, I was wondering if folks could point to, if you do know of any spaces to find healthcare advocates. So it sounds like Health Buddies is forming, and Uzoma is saying reach out to your MLA and they might be able to support you in that process. But are there other places where we can find a person, find someone to go through that process with us?
There are some that people should be aware of. There's in different facilities, there will often be something called a patient services or patient engagement. It's different at different hospitals. At Health Sciences, I think it's the patient engagement people. And so basically they're the people that you call if you have any thoughts as a patient there, what you need. And I also read about the Selkirk Mental Health Care Facility has a really beautiful online patients' rights. I think those are really great. But again, I think that those are specific to that facility. And so what I can say is that for First Nations folks, there is Indigenous patient advocate at the Winnipeg Regional Health Authority that you can contact for Indigenous services. And then there's also patient advocates at Assembly of Manitoba Chiefs, MKO, so the Northern First Nations, and SCO, the Southern Chiefs Organization.
Mm-hmm.
Thank you very much. Annie's putting them in the chat there. So yeah, those are the ones that I would recommend as for Indigenous folks or on those site specific ones.
Thanks, Michael. Did anyone else have anything to add? Mackenzie, I just jumped in temporarily because it looked like your internet maybe was not supporting you properly in that minute. But so I just asked folks to share if they know of any healthcare advocacy resources out there.
Can I add something to that?
Yeah, that'd be great, Sandra, please.
Yeah, Institution for International Women's Rights, they also do advocacy, and that combines all other communities, including the Indigenous community. And Men's Resource Center also provides some advocacy for men. And Manitoba Advocates, they play a great role providing advocacy for children and youth.
One thing that I would recommend is don't feel as though you can't call a resource because it's not necessarily identified as specific to the area that you're concerned about, right? So I used to be a clinician, and it was specific to youth intakes for the province. This is before politics. And we would get a lot of phone calls from family members or folks in the community who are adults who are looking for services. And we had all that information, right? So no, I can't complete an intake for you, and I can't be the one to refer you directly, but I do have a list of all of these resources that I can connect you to by providing the information. And actually, you know, in that conversation, what I would be doing is essentially an intake, right? I'd be asking key questions. I'd be kind of assessing what your needs are, and then I would make an appropriate recommendation to you based on that. And so don't shy away from reaching out to the resources that maybe are readily available or that have been provided that you're not sure about, because oftentimes, you know, unfortunately there are gaps in our system, but you know, a lot of those services are communicating with each other because we want to close those gaps. And so one service can often direct you to where you need to go. And the other thing that I would say, because we did talk about the importance of culturally appropriate resources, reach out to, if you're comfortable, and that's a whole other conversation about the reasons why we may not be comfortable reaching out to resources within our cultural communities. But if you are comfortable in doing so, reach out to organizations that you connect with on a cultural level of whatever kind to you. So for me, maybe I would reach out to the Nigerian Association of Manitoba or African Communities of Manitoba, or you know, the like that aspect of Sunshine House, or you know, QPOC Winnipeg, whatever it is, you know, whatever it is that I can identify with as part of my cultural identities, and see if they know of a resource that would be a good fit for me.
Thank you. Those are all some really great responses. I don't know if you can hear me. I just got an internet connection. It's unstable notification again. Oh, we're good? Okay. Yeah, it was really weird. I could hear everyone, but I couldn't talk. So, all right. Do we have any other questions for the panelists? I'm
I did just, I saw a theme in the comments, so it wasn't really phrased as a question, but I think there's a question in this. So in addition to the conversation that was going on about police and wellness checks, there was also a series of comments that really spoke to, maybe you have checked off the I'm going to ask for help, but when you do ask for help, you are met with trauma, or you are met with like you're trying to come with your whole self, and they take that as presenting like behavior, and they like misinterpret it or make judgments about it. Or they, yeah, as someone talked about, like people seeing the like asking for help as like hypochondriac behavior. And so I think this is, I think, related to self-advocacy, and obviously lots of systems changes and training that needs to happen as well. But what are your thoughts on how to respond in that situation, how to prepare and challenge that situation when it does happen?
Maybe quickly, I'll just say, I think part of why we want to develop health buddies and talk about things like patient rights is so that people can have somebody there in the moments where they aren't comfortable. And then the dream is to, like, over time, people learn how to assert their rights. You know what I mean? And then that's what the dream is. But I also just want to name something that people are like, it's easier to get healthcare for cancer than it is for mental health. And I think that's a little bit of a intense thing to say, but it is also probably a correct thing to say. But I will also say, not necessarily. A close friend of mine passed away from cancer due to not being believed when he went and presented with headaches as an Indigenous man. And so they thought he was going there trying to get drugs, and he did end up dying of cancer. And so don't speak so confidently that people trying to get support from the healthcare system for a cancer diagnosis are getting it, because they're not. And so I just wanted to name that from the chat, and also just explain that the dream of Health Buddies is that we are there because we recognize things aren't safe, and hopefully we're treating people what they deserve so that in the future they can do the self-advocacy that they need.
Something that I would add to that, and thank you for your comments, Michael, and I'm sorry for your loss. I think that what I'm seeing in the chat and what I'm hearing from some folks is that it is on some level more challenging due to systemic discrimination for some folks to access the care that they need in the time that they need it, and in a way that is dignified and respectful, and that sees them beyond the ways in which these systems can construct people. And that's all valid. That's all true. Those are all very real things that unfortunately still exist and persist within our healthcare system. And that still being a reality, that, as Annie has already kind of mentioned, that we need to do the work to deal with so that folks can access care easily and without those experiences. There are steps that if you're able to take them, you should, as you're making that journey to go and access care. And Sanda spoke about this earlier. So, making a list of what it is that you need to have addressed, going in prepared as much as is in your capacity, so that, and I recognize this for my own self, right? I'm someone who, if I am in an escalated state, even though I may not present it outwardly, if I'm in an escalated state internally or up here, there are things that I tend to not communicate that I need to communicate. And so I'm someone who often will take an extra moment to gather myself and write things down and kind of organize, not for other people. I'm organizing for me. I'm organizing so that I have my ish together when I go in there and I need to make sure that I get everything on my list addressed. And so wherever you can do that, I think it's really important. And I'll say this as somebody who's been the provider of care, somebody in this role now. There are situations where folks will come and bring their concerns, and they're really escalated, really frustrated, really disorganized, whatever it is. And maybe I'm a little thrown off, right? I'm trying to listen to what you're saying, and I'm trying to also assess like what's going on here. And something that is I do find really helpful is if you do have that information, you can kind of hand it to me, and it's like, okay, this is what's going on here, right? Okay, I can put that together. So I think that wherever you're able to do that and kind of go in prepared, then great. And again, if you can't, if there's somebody who can go with you, then awesome. And also the other thing is, if you leave a situation and you're like, I didn't actually communicate everything I wanted to or needed to, don't be afraid to follow up, right? Don't be afraid to follow up with a phone call or an email or a letter or whatever it is, so that if there was anything that was missed, you're making yourself that much more clear, right? You have the right to do that as well. So just something to keep in mind.
Thank you for that. I think Luca has a question, and they've been really patient because their hand's been up for like 5 minutes. So Luca, do you want to ask?
Thank you. I will lower the hand now. So my personal experience, it's gone two ways with seeking help. The first route was when I was trying to enter access to Selkirk Mental Health for their DBT program. The first time I accessed, I was told I wasn't sick enough, that I knew way too much information about my own mental health, my medication. Second time around, for the second interview, I was too psychotic to enter the program, so I was kicked out. So it makes no sense, because I've learned over the years, like, know about your medication, know about your diagnoses, and like know how to advocate for yourself. But I've realized in experiences, if you know that information, they don't take you as seriously, which is really unfortunate, because they teach you how to do this, and then when you act it out, you get pushed back. You don't get taken as seriously. Or like the fact I wasn't eligible for Selkirk, it kind of blew my mind, because I was like, well, because I'm kind of screwed, just because of the, like, so it's one direction or the other in my case. So there have been times when I've sought help, even though I know some of the answers, I'll play dumb. So I'm able to receive the help I need and make sure it happens. Because if I act a little too coherent, they don't take me seriously, and it's really unfortunate. So I wanted to point that out just a little. And when seeking mental health treatment, they only treat one diagnosis at a time. So if you have schizophrenia and an eating disorder, they will not treat the eating disorder until your psychosis is underlined, like under control, and then they will focus on whatever else, which also does not make any sense when treating, because it just, I don't know, I think people get lost through the hoops. While they're treating one illness, the other illnesses are acting up even more. So that's my little bit.
Thank you, Luca. Did we have, I think Audrey, your hand was up momentarily, but it went back down. Did you have a question?
Can you hear me?
Yes, I can.
Okay. I guess I have to have the video on to speak. That is also what I myself have experienced. I now have a terminal condition because of lack of being listened to. And even though I went in with all my papers in order, it then got me labeled as a hypochondriac, to the point even a doctor had, in order to get me my transit pass from EIA, told them I had an addiction. I didn't know that he said that until I found it in some paperwork and such. Now, how is it our doctors are acting like this? How do we get the doctors themselves to get out of that systemic ideology that every Native person wants to be on medication or want to be on EIA because they're too lazy to work? I had one doctor say to me, "Ma, you can articulate well for an Indian." How do we get that to stop? Because now the medication I have to be on is $3,500 a month for one medication for my lungs. And I need a double lung transplant now. Plus I have a spinal injury I've been dealing with, as far as they're concerned, at least 30 years. But was never diagnosed because I was never listened to. And yet when I spoke up, I did everything you guys all say to do. I got totally down to the point of, like I said, a terminal condition that is now costing the system 10 times as much than if they would have just listened to me the first time that it was my stomach causing an issue, right? But they didn't. And it wasn't just some supposed racists, because I had some doctors who were people of color, and they too treated me that same way and said, "I will only take your temperature once a year, when my medication means I need a blood test every month." And they said, "Well, that's irrelevant to me." You say, "Go get a second opinion." Well, then I had a doctor say, "Well, geez, you've seen so many doctors, I think you're just looking for something. You're doctor fishing." Who's teaching them that kind of stuff? How come they're not learning how to behave properly and treat patients properly while they're in the actual training phase? And why are others not taught that too? No one wants to be in abject poverty, because that's what disability does. It puts you in abject poverty and then a downward spiral health-wise, because you cannot afford food that is rational enough to feed a healthy body, let alone one disabled. And yet everything's thrown on the patient to speak up. We speak up. Greasy wheel does not always get the grease. Sometimes we get the rut. Where that drop that falls into the rut and gets run over. And I'm tired of hearing and learning about others who also are now terminal because the doctor did not listen. And even though they self-advocated, we need to get a hold of those doctors and the medical system itself and do it from there. Nip it in the bud, because that's where it's originating from. It's not originating from the patients. So I think we need to kind of switch that thinking and stop leaving it up to the patient and hit up the doctors who are not being properly trained. And also exposing it as the systemic degrading system that it is. Why are they having these ideologies that someone wants to live on less than 10,000 a year and thinking, "Oh, that's fine"? You know, it's ridiculous. But anyway, my rant's over. But it's happened so much. I found the only thing that did work with a doctor was when I said, and when she refused me a service, I said, "I want you to write that down in my file that you refused me dietitianary care." She switched her idea right around right away and sent me to a dietitian. And I left her services, and then luckily are now in with clinic. But now I'm terminal, so they don't really have much investigating to do now. But at least I know I'll have the advocacy that I need when it comes to my EIA papers. Because now, like I said, now it's a terminal case. But thank you very much for listening.
Thank you, Audrey, for sharing. So I'm going to throw it back to the panel for some closing remarks. Sanda, you've had your hand up for a while. You've been very patient. So if you'd like to start.
Yes, and first of all, I'm sorry to hear about Michael's friend. And Luca and Audrey, I really hear you. And every day we are dealing with such stories. And now we have included in part of our therapy to do a personal wellness check. It's not our job to look into people's well-being, like that's the GP's job. But we do ask, well, how are you doing with your medication? How is your communication with your family doctor? Are you comfortable with that? And we are not big advocates, but it's the need is there to ask and see whether the patients are getting a proper service and whether they are happy with that. And we are encouraging people, if the treatment are not compatible, tell them. And as Zama said, remind them, go for advocacy. You don't, it's your life and you don't have to accept. Of course, it's not easy to deal with so many things. And as Lucas said, you need to find a way with someone. Sometimes we, not to manipulate the system, but we help people how to get on with the system and get the service that you need to. On the other hand, we do understand, because people are said to be manipulating the system, there are strict controls. But on the other hand, it's sad to see how people who deserve the service don't get that appropriate treatment because of this thing. So there's a big gray line, and I think Michael and Osama people like you can really work towards bringing this to a closure and people being heard.
Something that I would say, and I'm going to get political now because I think it's important to be honest. You know, and I'm sorry, Audrey, for the experiences, and Luca, for the experiences you've had in healthcare. We know that it's a reality for so many people, and it's an unfair and unjust reality. I bring up politics because I'm a big proponent of representation in all spaces. I really fully believe that the lack of representation of people who have lived experiences navigating racist systems is a huge part of the reason why these systems are still racist and misogynistic and ableist and discriminatory. Because the folks who outline the training that doctors and nurses and healthcare aides and providers and educators receive are folks, more often than not, who have never experienced the system from any other place other than being in a privileged position. And when that is the foundation of which these systems are built and trainings are provided and education is accessed, harms will continue. And so on a foundational level, it is so important that in all of these spaces, we have people who are informing how things are designed and structured and policies are created from that lived experience, from that place of not just understanding as a theory what anti-racism means, but understanding from a lived in my community, my day-to-day life, have breathed in the air that is racism place, that is misogyny place, that is discrimination place, that is transphobia place. I foundationally believe that's part of the change we have to see in order for things to actually, for people to understand that it is life or death. And I say that in the legislature. I get angry when I talk about these things in the legislature. And I ask, where is the urgency? People are dying. And until we have more people who can step up and speak out and deal with these things in all spaces, not just in the ledge, right? In all these places where decisions are made from that lived place, that urgency isn't gonna be there. And the urgency is what we really need to get those changes happening yesterday. And like I said, I'm grateful to be here because I see so many people on this call who I know do that work as their life work, you know, as work that they do as part of their everyday comings and goings. And so, you know, I want for folks to know that we have to support that work. You know, we have to support that work in all spaces. We have to support those people and lift those people up in all opportunities that are available to us to make sure that we close those gaps and people we don't keep hearing and sharing these stories that we all know are happening to people that we love in our day-to-day lives.
Thank you for that. Michael, did you have any closing remarks?
Yeah, I know we're quickly running out of time, but I just threw in the chat the next general meeting for Health Buddies, if people are so interested in participating. We also put our email in there, and folks are able to maybe just send us an email introducing yourself so we know who the heck you are. And then we, share the Zoom link with you, or you can come in person. We're doing hybrid meetings now. Whatever you feel comfortable with, join on the Zoom or join us in person. And that's coming up the last Sunday of every month. That's when we meet for the Health Buddies general meeting. So we're putting a lot of principles of community organizing into the way we're doing Health Buddies now. And I suspect that that's kind of what we were missing before. And so I'm really hoping that with this kind of new structure that we have, Health Buddies Winnipeg will be able to be announcing in the very near future that our first cohort of Health Buddies are up and active with a schedule of when people can contact us for help. So the dream, that's the dream. But we need helpers to make it possible. So the one thing we also say at Health Buddies is we recognize the intersectional nature of all of our identities. And in doing so, we recognize that each of us have different privileges at different moments, at different times, depending on different audiences. And so if you can use your privileges, maybe it's your career, maybe it's your maleness, maybe it's your whiteness, whatever it may be. If you got some privileges, we want it over at Health Buddies because we are tipping the scales back in the favor of our relatives who deserve equity and good service. So calling all the Karens, if you want to use your superpowers for good, join us at Health Buddies Winnipeg, and let's kick the shit out of these people that are disrespecting our relatives and make sure that we get the healthcare all of us deserve. It shouldn't even have to be a fight. And I just want to acknowledge and say thank you to Luca and Audrey as well for sharing today, because I resonated very strongly, and I want to correct myself in saying that the squeaky wheel does not always get the grease. Sometimes squeaky wheel gets the shit end of the stick, and I apologize for my generalization. But we got a lot of work to do. I'm honored to do this work with the folks that are here on the call today. And I hope that in the very near future, we have like a whole army of Health Buddies that are ready to be like anti-racist, culturally safe, stand up for our rights, and make sure that folks are cared for in a good way.
Thank you, Michael. I appreciate the enthusiasm. So this officially and very sadly concludes our panel on mental health and patient advocacy. On behalf of the folks here at PACA, I would just like to take the time to thank our panelists, Uzoma, Michael, Sanda. We so appreciated having you all taking the time to come and join us this evening to talk about your work and to answer our questions about mental health and patient advocacy. It was really wonderful to learn from each of you tonight. I'd also like to thank the community members that joined us this evening.